Hey everyone, in this video I'm going to go over the brand names of some of the most commonly used medications in psychiatry. Just a little intro before we start, this is not an exhaustive list. I did not include all the brand names for each medication, and this is not medical advice. We're going to start off with the SSRIs. If you want to test yourself, be sure to pause after I say the generic name. First off, we have citalopram. Brand name for citalopram is Celexa, and for some of these medications I've included some high yield facts. So for Celexa, it's the SSRI with the highest risk of QT prolongation. Next up, we have escitalopram. Brand name is Lexapro. Sertraline. Brand name Zoloft. Next we have paroxetine. Brand name Paxil. Something important to know is that it's contraindicated in pregnancy. It can result in cardiac malformations and result in pulmonary hypertension. Next, we have fluoxetine. Brand name is Prozac, and this is the SSRI with the longest half-life. Next, we have fluvoxamine. Brand name is Luvox. So two things to know. This is the SSRI with the shortest half-life, and it's also the only SSRI that's not indicated for major depressive disorder, but it does have an indication for OCD. We'll move on to the SNRIs. We have venlafaxine. Brand name Effexor. Next we have desvenlafaxine. Brand name Pristique. Next we have duloxetine. Brand name Cymbalta, and one of the high yield indications for this medication is diabetic neuropathy. So we'll move on to the TCAs. First off, we have amitriptyline, brand name Elavil. Then we have nortriptyline, brand name Pamelor. And something important to know is that nortriptyline is actually a metabolite of amitriptyline. Then we have doxepin, brand name Silanor. Something important to know is that doxepin is actually the only antidepressant that's indicated for insomnia. Next, we have clomipramine, brand name Anafranil, and the most important thing to know about clomipramine is that it's the only TCA FDA approved to treat OCD. Imipramine, brand name Tofranil. We'll move on to the atypical antidepressants. First, we have trazodone, brand name Deseril. So two important things to know. Firstly, although it's not FDA indicated, trazodone is often used for insomnia, and an adverse effect to be aware of is priapism. Then we have bupropion, brand name Wellbutrin, and this comes in 3 formulations, the IR, SR, and XL form. And then this is a good antidepressant choice for patients worried about weight gain or sexual dysfunction. Then we have mirtazapine, brand name Remeron. And Remeron is a good option for patients who have a low appetite. It could potentially help stimulate that and get them eating more. Next, we have vilazodone, brand name Vibrid. One good way to think of Vibrid is to think of it as a SSRI plus buspirone or Buspar. Then we have vortioxetine, brand name Trintellix. We'll move on to our mood stabilizers. We'll start off with lithium, brand name Escalith. So a very important drug, probably one of the most important drugs in all of psychiatry. Lithium is one of 3 drugs that reduces suicidality. Also important to know is that it's teratogenic, so you want to avoid it in pregnant women because it can result in Epstein's anomaly. And then generally the way to think about lithium side effects is that early on it can cause some GI disturbances, and then later on it can result in more neuro side effects such as like ataxia and seizures. Next we have valproic acid and sodium valproate. This is known as Depakote, and it's important to know that this is teratogenic and can result in neural tube defects. Then we have topiramate, brand name Topamax, and an important adverse effect to be aware of is that it causes cognitive slowing. Then we have levetiracetam, brand name Keppra. One of the key side effects to be aware of for Keppra is that it can cause some sedation. Then we have lamotrigine, brand name Lamictal. An important adverse effect to be aware of for Lamictal is Stevens-Johnson syndrome, so you want to be sure to titrate upwards slowly. We have carbamazepine, brand name Tegretol. We'll move on to our typical antipsychotics. We'll start off with chlorpromazine, brand name Thorazine, and an adverse effect to be aware of are corneal deposits. Then we have thioridazine, brand name Mellaril, and over here it's not corneal deposits, it's retinal deposits. Haloperidol, brand name Haldol. Then we have flufenazine, brand name Prolixin. Something to be aware of is that Prolixin is available as a short-acting intramuscular injection that can be used for agitated patients. Then we have trifluoroperazine, brand name Stelazine. And then lastly in this class we have loxapine, brand name L'Occitane. And loxapine is interesting because it gets metabolized into amoxapine, which is a tricyclic antidepressant. And interestingly, because it's a metabolite of loxapine, it continues to have some antipsychotic properties. We'll move on to the atypical antipsychotics. We'll start off with aripiprazole. Brand name is Abilify, and this is one of 3 drugs that are partial dopamine agonists. Then we have brexpiprazole, brand name Rexulti. This is the second of the 3 partial dopamine agonists. And then we have cariprazine, brand name Vraylar, and this is the last of the partial dopamine agonists. Then we have ziprasidone, brand name Gedeon, olanzapine, brand name Zyprexa, and an adverse effect to be aware of is weight gain. Lorazepam, brand name Latuda, and this is one of the medications that can be used for bipolar depression. Next we have quetiapine, brand name Seroquel. Clozapine, brand name Clozaril. This is one of the medications that decreases suicidality, and a high yield adverse effect to be aware of is agranulocytosis. Paliperidone, brand name Invega. This is one of the medications that's available as a long-acting injectable. Risperidone, brand name Risperdal. High yield adverse effect to be aware of is hyperprolactinemia. Lumateperone, brand name Caplyta. Iloperidone, brand name Fanapt. Asenapine, brand name Saffris. We'll talk about benzodiazepines next. We have alprazolam, brand name Xanax. Clonazepam, brand name Klonopin. Lorazepam, brand name Ativan. Diazepam, brand name Valium. Chlordiazepoxide, brand name Librium. Then we'll talk about barbiturates, phenobarbital, brand name Luminol, methohexatol, brand name Bravitol. One thing to be aware of is that methohexatol is often used as an induction agent for electroconvulsive therapy. We'll talk about medications used in alcohol use disorder, acamprosate, brand name Campril, naltrexone. 2 different brand names to be aware of here. Rivia is for the daily oral form, and Vivitrol is for the monthly IM form. Next we have disulfiram, brand name Antabuse. We'll move on to stimulants. Amphetamine, dextroamphetamine, brand name Adderall. Methylphenidate, brand name Ritalin. Lisdexamphetamine, brand name Vyvanse. Next, we'll talk about medications used in Alzheimer's. Donepezil, brand name Aricept. Galantamine, brand named Razidine. Rivastigmine, brand name Exelon. Memantine, brand name Namenda. And remember, this is one of the NMDA antagonists compared to the other 3, which are acetylcholinesterase inhibitors. Then we'll talk about our non-benzo hypnotics. Zolpidem, brand name Ambien. Romaltion, brand name Rozarem. Zaloplan, brand name Sonata. Then we'll talk about some adrenergic agents. Clonidine, brand name Catapress. Something to be aware of is that this is an alpha-2 agonist. Guanfacine, brand name Intunev. This is also an alpha-2 agonist. Propranolol, brand name Inderol. Prazosin, brand name Minipress. And then something to be aware of is that prazosin is often used to treat nightmares and PTSD. And we'll finish off by talking about some other important drugs to be aware of. Bupropion, naltrexone. This is Contrave, and it's indicated for weight loss. Bupropion, dextromethorphan. brand name Auvelity. This is used for treatment-resistant MDD. Meperidine, brand name Demerol. High-yield interaction to be aware of is serotonin syndrome, so you want to be sure when this medication is used that it's not interacting with other serotonergic agents. Tizanidine, brand name Xanaflex, muscle relaxant. Valbenazine, brand name Ingrezza. Atomoxetine, brand name Strattera. Diphenhydramine, brand name Benadryl. Benztropine, brand name Cogentin. And remember, this is one of the medications that we use in the treatment of extrapyramidal symptoms. Hydroxyzine, brand names include Vistaril and Atarax. Buspirone, brand name Buspar. Ketamine, brand name Spravato. One thing to be aware of is that this comes in the form of a nasal spray. Thanks so much for watching. I hope this video is a good resource to help you memorize brand names for psych drugs. If you have any questions, please feel free to leave them below. Thank you.